In daily life, urinating more than 8 to 10 times a day is defined as frequent urination, and this condition is not normal. It is a condition that varies according to men and women. So what is the main cause of frequent urination in women and men? If you are experiencing such a situation, please pay close attention. See what are the reasons. Frequent urination means that an individual urinates more often than usual during the day or feels the need to urinate. However, the concept of frequent urination may vary from person to person. In this direction, in order for frequent urination to be accepted as a clinical disorder, it is necessary to see whether this complaint negatively affects the quality of daily life of the person. Frequent urination may accompany the complaint of frequent urination in situations such as the person's sudden need to go to the toilet or experiencing anxiety due to the lack of a toilet nearby. Frequent urination complaint may develop due to certain physiological or psychological conditions in individuals, as well as being considered among the important clinical symptoms as a warning for some important health problems. In this respect, people with serious complaints of frequent urination should be evaluated by a specialist physician. The need for frequent urination can generally be seen in internal diseases that cause dysfunction in kidney function or urinary tract for various reasons, or in conditions where the body produces more urine than usual. In this respect, frequent urge to urinate may occur in the course of the conditions and disorders we will list below. Urinary tract infections. The most common cause of frequent urination in the community is infections in the urinary tract. As a result of inflammation and irritation of the tissues due to infection, the feeling of continuous urination occurs. Certain drinks. Excessive consumption of caffeine-rich beverages with diuretic properties such as coffee and tea increases the amount and frequency of urine. Diabetes. In case of diabetes, since the sugar ratio in the blood is irregular, the kidneys work more than normal, and the amount of fluid to be excreted from the body increases. One of the early symptoms of diabetes is the desire to urinate frequently. Pregnancy. Especially in the last 3 months of pregnancy, with the increase in the volume of the baby and the uterus, the pressure on the urinary tract increases, and there is a relative increase in the amount of urine. Drug use. Frequent urination may occur in regular use of diuretic drugs. Old age. With advanced age, urinary retention becomes difficult due to the weakness of the muscles that hold urine in the bladder and urinary tract, and there is an increase in the need to urinate, especially at night. Kidney diseases. Frequent urination may develop in certain stages of kidney failure or in the course of various kidney diseases that lead to an increase in the amount of urine. Prostate gland diseases. In certain diseases that cause enlargement of the prostate gland, small and frequent urination may be observed in parallel with the enlargement of the prostate gland and pressure on the urinary bladder. Neurological problems. Frequent urination may occur in some neurological disorders in which the bladder is hyperactive. Vaginitis. An increase in urinary frequency may occur in vagina or vulva infections. Urogynecological problems. Urinary incontinence, sudden urge to urinate and frequent urination complaints may occur in functional disorders and hyperactivity of the urethra, which is the last part of the urinary tract in women. Trauma. Physical traumas are one of the important factors that cause narrowing in the urinary tract, making it difficult to urinate and creating the need for frequent urination. And kidney stones. Kidney stones that cause obstruction in the urinary tract can lead to an increase in urinary frequency. If nighttime urination affects your daily life quality, it is time to consult a doctor. If you wake up more than once a night and feel the need to go to the toilet and this disrupts your sleep patterns, a professional evaluation is required. In addition, if you experience symptoms such as pain or burning sensation when urinating, bloody urine, sudden increased thirst or unexplained weight loss, you should consult a healthcare professional immediately. These symptoms may be a sign of serious underlying health problems, and early diagnosis is important for effective treatment. You should definitely consult your doctor to learn more about frequent urination at night and to learn the right treatment methods. So, what is good for frequent urination? Now we want to give you the answer to this question. You can try some methods to reduce the problem of frequent urination. If your frequent urination problem persists despite trying these methods, you should definitely consult a doctor. Please pay attention to these issues against frequent urination. Balanced fluid consumption. As a treatment for frequent urination, you can pay attention to fluid consumption throughout the day. Consuming excessive amounts of fluids also causes problems from time to time. Therefore, it is important to adopt a balanced approach in water consumption. Urinary tract hygiene. Urinating after sexual intercourse and paying attention to the cleanliness of the genital area reduces the risk of urinary tract infections. Dietary changes. Limiting the consumption of spicy foods or acidic foods reduces pressure on the bladder. Fluid selection. Limiting the consumption of substances that can stimulate the urinary tract, such as caffeine and alcohol, reduces bladder irritation. And there are some frequently asked questions on this subject. Frequent urination is more often a symptom of which disease? Frequent urination can have many different causes, such as urinary tract infections, pregnancy, bladder irritation, urinary tract obstruction, vaginal infections, interstitial cystitis. But in order to find the underlying cause of this condition, you should consult a specialist physician. Causes of very frequent urination. Very frequent urination occurs due to certain reasons. In order to find these reasons, it is essential to consult a specialist physician. With the necessary tests and examination, it can be revealed why there is too frequent urination. How often does a normal person urinate? Fluid intake is an important factor affecting the amount and frequency of urine. For example, a person who drinks more water usually urinates more frequently. Consumption of substances with diuretic effects, such as caffeine and alcohol, also affects the frequency of urination. Therefore, urination may vary from person to person. So how often do you urinate? Urinary frequency is a condition that varies from person to person. Especially the amount of beverages consumed reveals the frequency of urination. For this reason, there is no specific interval for urination. However, if there is a sudden and significant change in the frequency of urination of the person, this situation should be evaluated by a specialist physician. Please do not forget to like, share and subscribe to our channel by commenting so that our video can benefit others. We wish you all a healthy and happy life. Goodbye.